By now, we've all heard the terms electronic medical records and electronic health records. While EMRs and EHRs are becoming a necessity in the medical industry, the question remains, how do we treat an increasing elderly population of patients without a reduction in productivity? Here to help us answer this question is Robbie Graham, Chief Information Officer of Jefferson Technical Services. Welcome, Robbie.
Thank you, Jackie. Thanks for having me.
Robbie, as I mentioned, everyone's heard about EMRs and EHRs at this point, but what are some of the challenges that medical professionals face in switching over to this new technology?
Well, those challenges from the physician to the front desk could be, does it do the job I need it to do? Does it do it well? Is it easy to use? Does it slow me down? Can I afford it? And ultimately, am I better off with it or making a change?
So explain who Jefferson Technical Services is and what you've developed to help doctors make it through this challenge.
Well, we've solved the problem by writing software, a product that we call Pine Belt EHR, written out of necessity by doctors for doctors to help them through their day in accessing medical records as fast and accurately as possible and to make the best diagnosis possible.
Well, let's take a look at Jefferson Technical Services solution in action in this 21st Century Health Field Report.
Pine Belt EHR by Jefferson Technical Services introduces a streamlined system of electronic record keeping that was created by doctors for doctors.
I believe this product improves patient care by allowing me to more naturally work through the complex problems that my patients have. It allows me to integrate laboratory data, imaging data, complex drug list, without having to flip between various screens. I can have all of this information presented to me simultaneously and integrated simultaneously.
With Pine Belt EHR, daily documentation tasks are drastically reduced, allowing practitioners to focus on patient encounters, increase communication, and improve clinical accuracy.
I use the Pine Belt EHR system to more efficiently see patients during my day, to accurately accumulate data with my patients, and I'm able to spend more time with my patients.
The basics of the system are incredibly intuitive. If you've ever used a paper chart, you used a chart that looks a lot like our EHR. It's so easy that when we have new physicians or healthcare providers come into our practice, in less than a day, they're at full speed.
Robbie, what would you say are the most important things your product does for the physician?
Well, the physicians are under increased pressure by the payers, insurance companies, the government, everything else, to provide an increasing amount of documentation for their treatment plans. And what our software does is it actually assists them through the process of obtaining those medical records quickly at their fingertips and through their day in hopefully getting to the best possible diagnosis as fast as possible.
So that benefits everyone all around.
Well, it does. I think it benefits the patient. I think it benefits the doctors. I mean, the baby boomers are growing, so we've got to be able to be there for them.
Definitely. What is the single most important feature that your product, Pine Belt EHR, provides the physician?
That would have to be helping the doctor through the day, through his schedule, since their patient base is growing, and we all know that. I think our software allows them to go about their day the way they used to, and they can either choose to dictate the encounter, they can type, they can use templates, they can use a product we've developed called vScribe that actually makes them, I believe, more productive throughout the day and get to more patients in a better manner.
Is there anything your product does that you believe is unique only to Pine Belt? Would that be the vScribe?
It really would. It's really new. It may not work for every physician. If you have an overwhelming patient base that you need to get to and you need to make it through your day, what vScribe does is it's a virtual transcriptionist that's been retrained to be sort of like an EMR diva, where she knows the EMR system very well, and she listens to the physician as he's in the exam room, and she's able to see what he does on one screen as he scribbles his notes, maybe his assessment and his plan, and filling drugs and talking to the patient, while she's also documenting the notes so the physician doesn't have to. He doesn't have to type anything. He just has to do the exam like he used to in the old days. And when he finishes, the note is done in near real time.
In near real time.
Yeah, I'm saying near real time because it may not be finished exactly. And some doctors it will be, some doctors it won't. So when he exits an exam room, he talks to the V-scribe and says, did you get that? I mean, you know, here's a quick blurb of information that you might want to put in the note, and then I'm going to go to the next exam room and pick up another V-scribe.
That's amazing. So this is done really with today's technology, the camera link, the screen, the talking, the microphones, all of that. It's really putting the best use of today's technology to work in the doctor's office.
Tablets, pens, they have a desktop with multiple screens so that they can pull up x-rays and compare them. So you're not limited to just a single screen. Some of them have 3 screens so they can have 2 x-rays up at the same time and then EMR up on another one.
It sounds so smart.
Pretty cool.
It does. How long does it take for a physician to learn how to be productive with your product?
You know, it's not very long. If he's going to use a template system, then it'll be longer because that's like learning a roadmap, your way through something. If he's going to dictate like he normally does, really going into an encounter, double-clicking and dictating is very fast. Using the drug system is extremely fast. He's up and running in an hour or 2. If he's going to use vScribe, he'll probably have to script it out with the vScribe. When I say this, I mean this, you know, type this and stuff like that. They're all up and running within a couple of hours and very fast.
It sounds so much quicker. You know, I do have a doctor who is a young guy, but he still insists on doing the transcription into a tape recorder, using real tape, not even digital, and that goes to the transcriptionist, and I don't know how long that takes, but it seems so cumbersome compared to what you're talking about.
Well, that's where we started. So you can dictate into the computer, and it pops up on the transcriptionist screen that this needs to be done. And if the patient has another encounter, another patient visit in the future, it's important to notify the transcriptionist that that encounter needs to be transcribed so that the doctor in the future can have that information available for him to do his treatment plan as well. So whether you dictate or vScribe, I think you will not see a reduction in productivity.
What about the staff? What does your product require from the doctor's clinical staff?
You know, not too much. The division of labor is such that you've got a front desk, you've got a nurse, we have actually a nurse pool, we've got a clinical assistant pool. Phone calls come in, somebody's got to learn how to make the appointments. That's really easy. Once the appointments are made, the front desk has to learn how to check in a patient. That's very easy. That's really quite easy. Then the status pops up at the nurse's station. They see the patient's here, they send somebody out to get them, change the status, the patient's in the room, the doctor sees that, he pulls up the previous historical information. Most of it's available at the movement of a mouse, not just the double clicking. Then he does his thing.
So what do you predict for the future, Robbie, for this portion of the medical industry and for Jefferson Technical Services itself?
You know, there's a lot of debate on where the future is in medicine or anything else, going from expert systems to artificial intelligence. So I don't exactly know where that's going to be. You know, I think we're a long way off from writing software that you can teach to play chess rather than a software package that can play chess. So writing a package that can, based on the symptoms, diagnose a patient accurately is something. I don't know that that'll ever be achievable. Some say yes. You know, I kind of hope no, because I don't know how to do that. So it would be nice to just continue meeting what their requirements are, notifying the doctor that the patient's over 50, maybe they need a colonoscopy, you need to ask that question. One of the benefits of having a vScribe is the physician can say, look, Robbie, you're over 50, have you ever had a colonoscopy? And you say, yeah, I had one 2 years ago. Well, the physician can now say, okay, we'll document that. Well, he doesn't have to document it because the vScribe will make sure that happens, and then we won't ask that question again to that patient for several years in the future. Or if he says, well, yeah, I probably need to have that done, then the doctor can say, we'll set that up. He doesn't have to fumble with the scheduling system or the computer system or communicate anything more to any other person. The vScribe will handle communicating that to the nurse in the department, and they'll schedule the appointment.
Well, Robbie, this really does sound like game-changing technology. Thank you so much for coming to share it with us.
Thank you very much.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.